We are at the IMA headquarters here in Thiruvananthapuram. Here, doctors have been protesting from early morning today. This is a day-long protest by the doctors. The junior doctors, the seniors are all here. Their demand is that the attack on doctors in hospitals should stop. That is something which they want to say it hard and loud. We have senior doctors here. Dr. John Panikar, can you just tell us what exactly are your demands and what do you think are the problems here at the moment?
See, the problem is, especially after the COVID, the violence against doctors have tremendously increased in Kerala. Even for a very, not the fault of the doctors, anything happening, even a death happens in a hospital, the people are just attacking the doctors and other healthcare sisters and all. They think that there should not be a death at all. See, this is really absurd. That's why there is a tolerable level for all this. Now it has gone beyond the tolerable level. That's why, see, every week there are more than 3-4 attacks happening in Kerala. That too very seriously. And another thing is, the Indian Medical Association had been working for this, against this, and lobbying with the government to make it a very strict rule. The problem is that there is, even though there are so many hospital attack cases, the penalty or a case taking in that law is a very, very few. So that's why we wanted to make the rules more strict and implement it also. But we have met the Chief Minister, everything, but unfortunately nothing has happened. So the whole doctor community is in a desperate situation. It is a do or die situation now. That's why as a last resort, we have our state president of IMA and secretary. Probably they will talking more
Dr.
about
N.
this.
Sulfi, who's the state president of IMA here. Doctor, what are the demands and what is it that forced you all to come out in a protest like this today?
You know, it's absolutely a desperate situation in Kerala. You know, every week an attack happens, and actually we are doing this strike to save our lives. We save people, and now the strike is to save our own lives. We need a protected environment to treat patients and save lives. And it's not happening here. And many are almost all the entire medical fraternity is frightened about the existing situation in Kerala. So you know, the last attack which happened at Calicut, you know, the attempt to murder is in charge, but still the culprit is out. He's not yet arrested. So our primary demand is that the culprit must be arrested. But we need to implement the directives given by the High Court regarding the special hospital attacks, and also we need a special protection zone in Kerala. But the most important thing is the existing rules in Kerala. The 2012 Hospital Protection Act is very mild, and we need to amend that. And the government has technically agreed to do that, but we need to do it in a very fast pace. So not only that, we need the government and the authorities to implement those acts existing in this country, and also that the main issue of the main aim of this strike is to make the public of this Kerala aware that this is a problem existing in our state. And actually, if this situation continues, the doctors have already gone to defensive medicine, and they'll make their issues very safe, and then only they'll go for risky treatments, and that is very bad for the patient. Basically, this strike is for the public.
So you're saying that youngsters today are having doubts when it comes to taking up medicine. So you think that is also a concern?
Absolutely. See, the thing is, you know, it's a very, see, you can see the young students here. They came from medical colleges in Kerala, and you know, it's almost more than 10 years to establish yourself as a very good doctor with a specialty and all. But after 10 years, you are not practicing in a safe environment. You know, it's a difficult thing to any youngster. And you know, many youngsters are taking up other specialties. But the problem is, we need the cream of the society to come to medicine, because it's a specialty in which you have to work. It's a profession in which you have to work till your death. To study those things, you have to do research. You have to update your knowledge every day. So we need cream of the society to come to this profession. For that, we need a safe environment.
So any of these youngsters, are you concerned about the situation?
Yes, sir. Yes, ma'am. What I have to say is that we are not alone. Now we have our own peoples to ask for ourselves. Thank you for the IMA for organizing such a event, and I thank all the people and all the medical college students, teachers and faculties for coming here. Thank you.
As a young student, are you concerned about what is happening right now as a young doctor?
For sure. We have been studying since 10th. We have been preparing for entrance exam. We have been working really hard. We spent nearly 5 years working our ass off day and night, and we're coming into a society where they don't respect us. We are working day and night, we are working 24 hours, we are working without sleep and food, we are depressed. There are people who are really depressed. The suicide rate in medical students are really high. We are giving up everything for this profession. We are working really hard, and what do we get? What do we get? We are getting all this beating from the society. We are getting all these rude comments. Society thinks that we are just rich people. The society just thinks that we get a lot of money from this profession. No. We are giving everything we have and everything we can, and we are not getting anything back like that. And that's really sad, because as a child we always dreamed about doing a lot of things, but in the end, when we reach this profession, when we are getting such a response from society, it just really affects us, and it will affect the future society and the future generation who are aspires to become doctors.
What's your name?
Anjali Ravindran.
Yeah, please go to the doctor, Chief Secretary also. Yeah, please.
Oh, okay.
No, basically, see, the president said much, and even the students have said, but from the perspective I see this is, we're doing it for the next generation. Because unless we provide safe havens for them to practice, the president was mentioning about, the young generation, the cream of the society, especially the student community, hesitating to take medical profession. But even doctors, young doctors who complete their profession, they are migrating overseas. And so there's going to be a glut in good quality doctors probably in the years to come in Kerala, and that's going to adversely affect our healthcare delivery system as well as the public. So let's hear from what she's got to say on this.
What we believe is all humans have rights, and doctors are also humans. So this is a fight for our rights.
So we heard the senior doctors as well as the young doctors telling us about the situation, what they need from here, and how concerned they are about the future of medicine. So they say it's not just a protest for themselves and their safety, but also for the public.